Heat stroke is more than fatigue, a brain-threatening emergency. India has been gripped by a severe and record-breaking pre-monsoon heat wave, with temperatures frequently soaring between 43 and 47.6 centigrade across northwest and central India. That is up to 117.7 Fahrenheit. Heat stroke is not just feeling tired in hot weather, it is a dangerous emergency that can quickly affect the brain, heart, kidneys, and muscles. When the body temperature rises above about 40 degrees Celsius, the body can no longer cool itself properly, and this can become life-threatening within minutes. Research from major health organizations shows that heat stroke can damage the brain permanently if treatment is delayed, especially during heat waves and high humidity days. Many people think heat stroke only happens to athletes or outdoor workers, but it can happen to anyone, including older adults, children, and even healthy people sitting inside hot rooms. Cars without proper cooling, crowded spaces, poor airflow, and dehydration can all increase the risk very quickly. But some medicines for blood pressure, allergies, depression, or diabetes can make the body struggle to handle heat properly. One of the most dangerous parts of heat stroke is how it affects the brain. The brain depends on stable body temperature to work normally, but extreme heat can cause confusion, poor judgment, slurred speech, and strange behavior. Some people may suddenly become aggressive, dizzy, forgetful, or unable to recognize family members. As the body temperature keeps climbing, the brain cells start to suffer from swelling and inflammation. This is why some people collapse, faint, or lose consciousness during heat stroke. But seizures and coma can also happen if the body does not cool down fast enough. While we're in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to me encouraged to make more videos. A lot of people mistake early heat stroke signs for simple fatigue. They may think they are just tired after walking outside, gardening, or working in the sun for too long. But ignoring the warning signs can turn a serious condition into a medical emergency very fast. One common warning sign is very high body temperature. The skin may feel hot to touch, and the person may stop sweating even in extreme heat. But some people can still sweat heavily during heat stroke, so sweating alone should never be used to judge danger. Severe headache is another important sign. The heat puts stress on blood vessels and the brain, which can cause pounding pain and pressure in the head. But if headache happens together with confusion or dizziness, emergency help should be called immediately. Rapid heartbeat is also very common during heat stroke. The heart starts pumping faster because the body is desperately trying to cool itself down. But this extra strain can become dangerous for people with heart disease or high blood pressure. Nausea and vomiting may also appear suddenly. The stomach and digestive system slow down when the body is under extreme heat stress, but vomiting can worsen dehydration and make the condition spiral out of control faster. Breathing may become fast and shallow as the body struggles to manage heat. Some people feel weak, shaky, or unable to stand properly, but muscle cramps can also happen because the body loses important minerals like sodium and potassium through sweat. Children are especially vulnerable during hot weather. Their bodies heat up faster than adults, and they may not realize they need water or shade. But babies left in hot cars are in extreme danger because temperatures inside vehicles can rise within minutes. Older adults are also at high risk. As people age, the body becomes less efficient at cooling itself through sweating and blood circulation. But living alone, having chronic illness, or taking several medications can increase the danger even more. Humidity makes heat stroke more dangerous because sweat cannot evaporate properly from the skin. Even temperatures below 35 degrees Celsius can become risky if humidity is very high. But many people focus only on temperature and forget how much humidity affects the body. Dehydration plays a major role in heat stroke. When the body loses too much fluid, blood flow becomes weaker and cooling systems stop working properly. But thirst is not always an early warning sign, especially in older adults. Alcohol can also increase the risk of heat stroke. It causes fluid loss, affects judgment, and can make people ignore warning signs from the body. But sugary drinks and too much caffeine may also worsen dehydration during extreme heat. If someone shows signs of heat stroke, emergency medical help should be called immediately. Move the person into shade or an air-conditioned room as quickly as possible, but do not wait for symptoms to become severe before taking action. Cooling the body quickly can save the brain and organs from damage. Remove extra clothing, place cool wet towels on the skin, and use fans if available. But ice packs placed around the neck, armpits, and groin can help cool the body faster because major blood vessels pass through those areas. If the person is awake and able to swallow safely, small sips of cool water may help, but never force fluids into someone who is confused, vomiting, or unconscious because choking can happen. Medical professionals may need to give fluids directly through a vein in severe cases. Research shows that quick treatment greatly lowers the risk of permanent organ damage and death. The first hour after symptoms begin is extremely important during heat stroke emergencies, but delaying treatment can lead to kidney failure, brain injury, or dangerous heart problems. Heat stroke prevention starts with simple daily habits. Drinking enough water, wearing light clothing, and avoiding heavy outdoor activity during the hottest hours can lower risk significantly. But many people underestimate how quickly heat can overwhelm the body during summer. Checking on family members, neighbors, and older adults during heat waves can save lives. People living alone may not realize how sick they are becoming in extreme heat, but community awareness becomes very important during long periods of high temperature. Air conditioning is one of the most effective protections against heat stroke. Even spending a few hours in a cool shopping center, library, or community building can help the body recover from heat stress. But fans alone may not be enough during extreme heat waves, especially when temperatures are very high. Athletes and outdoor workers should take frequent breaks and avoid pushing through exhaustion. The body sends warning signs before collapse happens, and those signs should never be ignored. But pride and pressure sometimes make people continue working even when they feel dangerously overheated. Pets can also suffer severe heat illness. Dogs and cats can become overheated quickly because they cannot cool themselves like humans do. But leaving pets inside parked cars for even a short time can become deadly very fast. Climate experts report that heat waves are becoming more common and more intense in many parts of the world. This means heat-related illnesses are increasing every year in hospitals and emergency rooms. But awareness and quick action can prevent many tragedies before they happen. Heat stroke is not just about feeling weak or tired after a hot day. It is a true medical emergency that can injure the brain, damage organs, and take lives within a short time. But recognizing symptoms early and cooling the body quickly can make the difference between recovery and disaster. If you think this video is useful, click the like button and subscribe to my channel. It is a simple help to me encourage to make more videos. Thanks for watching.